Hello, and welcome to week 3, module 3, where we are going to be talking about digestion. If you have watched my YouTube video on HRT, you already know that the loss of estrogen affects every organ and tissue in our body, and that includes our digestive system, which begins in our mouth and ends down here at our anus. Here's a list of common digestive problems that perimenopausal and menopausal women experience. Some of these you may not have thought about. So we have reflux, GERD, constipation, which is less than one complete bowel movement a day. We can experience bloating, food sensitivities. We can experience nutrient depletion, and then also pain in the upper right side of the back, that quadrant up there, sensitivity to eating fats, and then also gallbladder issues. So these are all the issues that we may actually experience. So I'm going to run down this list so you can understand what's going on and how estrogen plays a role in all of this. Our digestion actually begins in the mouth through the enzymes that are produced from our saliva and from chewing. The loss of estrogen affects saliva production, and that can cause dry mouth, slowing down the digestive process from the very beginning. Acid reflux can be due to not enough stomach acid. I know that sounds counterintuitive. It can also be caused by a nasty bug called H. pylori. Excess weight, it can be caused by a hiatal hernia or a weakened esophageal sphincter. Think tissue integrity and collagen when it comes to estrogen and keeping the acid where it needs to be or supposed to be, which is in the stomach, not coming up through the to the esophagus. And the esophageal sphincter needs that estrogen to work properly. The loss of estrogen can lower the production of stomach acid and digestive enzymes, both needed to break down our food, making our nutrients available and to prevent the stagnation of food particles and then our waste. All of this can affect the peristalsis of the gut, slowing down transit time, a contributing factor to constipation. So bloating. Bloating can be due to a lack of stomach acid, low digestive enzymes, and constipation, but it can also be due to food sensitivities, which are most often caused by a leaky gut. And yes, that is a term. Our gut is only one cell layer thick, so there's not much between it and the rest of our body. And again, estrogen is super important for tissue integrity and maintenance and collagen production, which all protects that stomach lining and keeps it the integrity of our small intestine. With the drop in estrogen, our digestive tract can become more leaky, and when our small intestines are leaky, food particles actually leak out, and it can cause inflammation and increase food sensitivities. Nutrition depletion can be due to all of the above and is something to be aware of. If stomach acid is low, it affects our ability to break down our B vitamins and minerals. Low vitamin B status can translate into heart health and our neural health and our brain health. So think dementia. So this is nothing to sneeze about. Pain in the upper right-hand quadrant of the back, along with an increased sensitivity to eating fats, can be an indication that there is an issue with making and moving bile to where it needs to go, which is why we see the majority of gallbladders being removed during menopause. Estrogen helps our body produce something called choline, which is the backbone of making bile. I have a wonderful blog post, and the link for this is on your PDF about digestion. For some women, the drop in estrogen really affects their ability to make bile. There's actually a genetic component to that, which I happened to stumble upon. I had my genetics tested, and it came back showing that I have a genetic SNP, and that's what they call it, where I have a hard time making choline. When you think about choline and bile, think dry skin, the ability to absorb your fat-soluble vitamins, and also bowel movements, because bile does help with peristalsis. Bile actually helps with all things digestion, and I call it our magnificent little gold, liquid gold. About 5 years into menopause, I was fighting some constipation. My heels were cracked and bleeding, and my skin was really dry. And these are things that, you can associate with low thyroid. And I did have that checked, and my thyroid is absolutely fine. So, like, what else is there? Once I increased my estrogen replacement, and maybe even more importantly, in my case, I started on a choline and gallbladder support supplement, my heels healed right on up, and my lingering constipation issues also were resolved. This is a side note here, but I think it's really important. It's important to understand an individual's own health history and also their family history, because we can kind of glean a lot of things from that and know what direction to go in. It's helpful. My mom had had a history of gallbladder trouble and eventually had hers removed. Not surprising once I saw my genetic profile. And because of the things that I've done, hopefully I will be able to keep my gallbladder, because it is important. Now, even though estrogen is kind of the star here with digestion, progesterone also plays a role. It plays a supporting role. Okay? Remember that progesterone is the hormone that calms. That calmed state is needed for the proper stimulation of the vagus nerve, which is super important for the rest and digest and even swallowing part of digestion. If we're moving through life in a stressed out state, our digestion will be affected. For some, it means that more stomach will be produced. For others, it means that less can be produced, causing either acid reflux, which actually 50% of menopausal women suffer from, or it can cause slower stomach emptying, or both. By the way, when I see inflammation markers go up on blood work, I always look more closely at the gut and oral health, even if there's not anything obviously going on. I want to touch on how important a healthy microbiome is. Our gut is the seat of our overall health, and our microbiome, which are the bugs in our gut, rule us as their DNA outnumber our own by about 100 times. So we want our bugs in our gut to be really happy. The best way to keep them happy is by feeding them tons of fiber that we get from the plants that we eat. This is why I encourage us to have 2/3 of our plates covered in plants, mainly veggies, but also some legumes and a few grains thrown in there on occasion as well. Okay. If you're having any of the gut issues I've covered here today, please seek help. It's really important to have them resolved because it affects your overall health. All right, that's it for module 3 or week 3, digestion. Have a good week, and I will be here again next week for module 4.